Hey everybody, this is Bridgit Danner, and I'm very honored today to have with me my friend and colleague, Dr. Fiona McCulloch. She is a naturopath out of Toronto, Canada, and she's an expert in PCOS and female hormones. And we're really lucky to have her on to share some knowledge and answer some questions. If you have any questions as we go here, feel free to type in the chat. And welcome, Fiona.
Thanks, Bridget. It's awesome to be here with you today and your audience. Thanks for inviting me.
Yeah. Fiona and I are both like teeny tiny. In case you didn't know that, when I met, I'm like, oh,
You're one of the wee folk.
we're some of the wee people that we didn't know until we met each other.
Yep. And we are quite wee, if you're
We're
wondering.
very wee. We're very
Yeah.
wee. Yeah, I was at an event last month and someone was like, I always pictured you as like a big, hearty German woman. And I'm like,
No, I'm actually a pixie.
little pixies. I've been a fan of your work, Fiona, for quite a while. You have a really great blog. There's a lot of detailed articles on there. I think that's how I probably first found you. And we're both in the fertility space. And I think today we're going to focus on mostly on PCOS, which is people said for a long time is the most common female hormone disorder. It's probably still true, huh? What do you think?
Yeah, absolutely. In fact, it seems to be more true. Now they're estimating that 1 in 5 women have PCOS. So it would
Really?
definitely be the most common. Yeah.
Okay. Do you want to just quickly define what PCOS is and maybe a bit about? Um, I think that there can be a misunderstanding that it's like doesn't apply to older women. So, and we have a lot of older women on this. Shouldn't say older. We have a lot of middle-aged women in this community, and I would like you to, yeah, just define it and talk a little bit about how it's sort of a lifetime situation.
Sure. So PCOS stands for polycystic ovary syndrome, and it's always been thought of in medicine as a reproductive condition, in that it definitely can cause issues with fertility, but at the same time, it's actually a lifelong hormonal condition. So even though a woman might be past her childbearing years, all of the symptoms of PCOS will continue to persist. So what's really important to know about it is that it actually has two very separate and important components to it. One is a metabolic component. So that means that women who have this condition will be more prone to prediabetes, insulin resistance, and weight gain. And then the second component is that there's a hormonal imbalance in the condition. And primarily, this revolves around a little bit too much of hormones that we call androgens, which include the hormones like testosterone that give males the characteristics that we would ascribe as being male. So, facial hair growth and those types of characteristics are what androgens produce. So, women with PCOS have too many of these androgens. And so they often have symptoms of that, which include hair growth on the face, hair loss from their head, or acne. So there's those two components, and along with the androgens, women may have difficulties with ovulating or irregular cycles because too many androgens can cause that to happen. But as women get older, that part often resolves, and the androgens or the testosterone in the blood often look normal, but women can still continue to have those symptoms of too many androgens, and they can also continue to have the symptoms of the metabolic issues like insulin resistance and weight gain around the stomach. So even though some of the elements of the condition get better when women, do get into middle age, a lot of the other elements remain just the same. And yet in medicine, we're kind of told that once, you've had children, that's it. You don't have to worry about this anymore, but you absolutely do.
Okay. Yeah, I think I've understood it as like as hormone levels on the whole lower, you might have with age or, menopause, you may have less, yeah, of some of those symptoms. But well said, you still have insulin resistance. And I would imagine that it's increasing because of the way we eat nowadays. Probably also toxicity. What are your thoughts on this growing number of women with PCOS?
So I think that how we eat exacerbates the problem. So if, because there's a lot of insulin resistance, anything that would cause increased weight gain obviously will exacerbate that. So the Western diet, the refined carbs, the sugar that we've all been consuming as a population will definitely make PCOS much worse because the more insulin resistance you have, the more, abdominal weight you may have gained, the worse the symptoms are because insulin in PCOS causes the ovary to make testosterone. So that's one element, but I view that not really as a cause, but more as a factor that makes it worse. When it comes to the environment, I actually view that as a cause. So there's a lot of evidence now that shows us that a lot of these endocrine disruptors in the environment can cause PCOS. So if an embryo is exposed to them, the baby can develop PCOS. And also, they exacerbate and aggravate just like the food. So, if, say, for example, you have genes for PCOS, so it is genetic and it does pass in families, but if you have the genes for it and you're exposed to endocrine disruptors, I know you talk a lot about this to your audience, then you can actually make your PCOS worse. But we think, in fact, that some of the increase in incidence might be the cause of that might be endocrine disruptors in the environment. So it's quite
Mm,
concerning.
okay. And that's interesting you said about the food. You don't think I'm kind of referring to like the high carb diet that many people are into, where most of us are eating nowadays, except the smarty people in this group. But you're saying that's just exacerbated. So that's good news. So when you clean up your diet, it can lower the symptoms.
Hugely. It makes a huge difference. Yeah. And for example, like there's a lot of people who, for example, are very insulin resistant, have gained a lot of weight from eating, say a lot of fast food, but they don't all develop PCOS. So there's something very different about
True.
PCOS. But there's also the endocrine disruption part. And then so the insulin resistance, it's definitely a very strong aggravator. But I really think that when you're looking at reducing toxicity in the environment, you're not only, helping your own symptoms, but also especially if you haven't had children, this would actually be helping your future children, especially if you do this in pregnancy. And then for your own children, like if you're a mother, helping your children avoid these would also be preventative for PCOS as well as they go through adolescence.
Okay. Yeah, great tips. So, well, I heard you were like advertising a speech or something you gave, and you were talking about intermittent fasting or time restricted eating, I think, or just that general topic. Maybe you were talking about just entirely circadian rhythms and
Hmm.
PCOS, and I thought that was very intriguing. I had never heard anyone talk about that before, so I wonder why you think that's an important topic and kind of some of the highlights there.
Yeah, so for PCOS, I mean, there's a lot of research on the metabolism because, as we mentioned, like when you make that change, it makes the biggest difference. So if somebody is able to go from a diet that causes them to be secreting a lot of insulin, like a high carb, high sugar diet, and they're able to change that and secrete less insulin, their PCOS will get so much better. So circadian rhythm and intermittent fasting, the way that these help is actually through helping with the metabolism. So we're also looking at helping with the insulin resistance there. Um, Women with PCOS are much more susceptible to problems with circadian rhythm. Circadian rhythm is really important for our liver function, and our liver really regulates our energy metabolism in the body. People think that it mostly does detoxification, but actually it's very much involved with our energy metabolism. So intermittent fasting would be periods of time where you're eating within an eating window, and then there's other periods of time that you're not eating. So the correct term for that is actually time restricted feeding. Um, but this has been shown actually to reduce metabolic inflammation markers like CRP levels and reduce insulin, even if the same number of calories are consumed throughout the day. So just restricting the window alone can really help with the metabolism. So my talk was a lot about that, like different ways of adjusting your metabolism based on circadian rhythm. So sleep, light and dark, and then fasting and feeding cycles.
Nice. Yeah, we had Sachin Panda on the show, and that was really fascinating for me. I've been kind of trying to mind my eating cycles more as well. And to be honest, I used to be kind of poo-pooing about fasting because um a couple of reasons. I think that women can get a little bit mental about about restricting
Yeah.
eating and dieting, and then sometimes I felt like restricting eating would throw off your blood sugar when you have adrenal issues and blood sugar issues. But my opinion is actually starting to change on some of that. I mean, some of the time restricted eating, like eating within a 12-hour window, for instance, is very reasonable. And if to go a little shorter, um, some days a week or all the days of the week, it is reasonable to. And you can also ease into things. So I'm starting to
Yeah.
experiment with more, and I am liking it. And I think that, I think it has a lot of bearing. So I'm glad we touched on that a bit. And if people didn't see that interview, we have it on our YouTube channel. People can check that out. Um,
That's amazing. Yeah, I'm a huge fan of Sachin Panda's work. So fascinating.
Yeah, really nice guy too. One that I want to highlight something else. Well, I don't something about your book, 8 Steps to Reverse PCOS. You talk quite a bit about testing options, and that's a question I get a lot in our community. And you probably can't go over like all of it because I think there was quite a bit in there.
Yeah.
But maybe I don't know if there's a few things you could highlight. And people should definitely buy the book. If you have PCOS and you don't have this book, you need to get this book. It's very detailed on supplements, on testing. She gives everything. Like, it's a
Uh,
very generous book. It's great. So we can't get
thank
over all of it, but
you.
I wonder if you can hit a few highlights, Fiona.
Yeah, so I'm gonna probably talk about a whole bunch of things, but if you also want, I can give everyone a link. I have a lab test guide, which is like a chart and it's really easy to read. So you wouldn't have to, I would definitely recommend getting the book, of course, but if you want a kind of concise lab test guide, I'll definitely give you the link for that.
Okay, great.
So the tests for PCOS are really dependent on the person. So um, obviously, you want to look at the metabolic markers. So, fasting insulin is a really good test. That's going to tell you if you're insulin resistant. So, for most people who are insulin resistant, their fasting insulin would be above 8 of in the US units and about 50 in the Canadian units. And you'll have to forgive me, I might say some of the Canadian units along the way because I don't always know off by heart the US and I have to plug
Oh,
them in.
sure.
So you can always do that. There's a great site called NMemo if anyone's wanting to convert any units. So insulin. There's also another great test which we do a lot in the clinic called the insulin glucose challenge. This is the glucose tolerance test where you drink the glucose drink, but insulin is also added at each marker. And this people who have insulin resistance, even if it's mild, you'll be able to see it on this test. Whereas sometimes people have normal fasting insulin, but they have abnormal insulin responses when they eat. So this test will pick that up. So we do that a lot, and it's quite interesting to see um, the different types of patterns of insulin release. So those are really important. The other ones I would say in the same category, which would be the metabolic category, would be HSCRP. So that's a marker of inflammation. That one is often elevated in PCOS, and it's a marker of chronic low-grade inflammation. A cholesterol panel looking at triglycerides is really important. And then some of the standard tests for glucose tolerance, like HbA1c and fasting glucose, it's also helpful to look at. Also, those can be normal though, and the insulin can be way off. So a lot of people get those done and they're like, oh, I'm fine, I don't have any problems. But HbA1c and glucose are not enough to pick up insulin resistance. They'll only pick it up when it's so severe that you've got abnormal blood sugar.
Okay, that's good tips. Okay, so
Yeah.
that's more in the metabolic category. Are there things you to like to test for in the hormone category?
Yes, and hormones are really different depending on a woman's age. So that's the biggest thing to remember. So with a very young woman with PCOS who's maybe 20, her hormones are going to look very different from a woman who's like 40, for example. And the biggest difference is with the levels of the androgens. So testosterone like hormones, those include testosterone, androstenedione, DHEAS, and dihydrotestosterone. So those levels all do decline with age. And then there's an increase in some of them at perimenopause that you'll see that happens for a short period of time, just as women go through that. And that's why a lot of women, when they're going through perimenopause, they're like, well, I feel like I'm having puberty again because it's almost a very similar hormonal state. So just knowing that and looking at tests, it's important to consider that the reference ranges the labs give include all ages from age, 16 to age 50. And so you can't use those reference ranges to say whether or not you're normal for androgens. They're just not accurate. The vast majority of women will have normal androgens, even when they have PCOS, even if they have a lot of hair growing out of their face or their hair is falling out and it's obviously from too much testosterone, they could still have normal testosterone. So don't put too much into that test. It's something to look at, but you have to look at it knowing what's normal for that age group. So there's that to keep in mind. The other hormones that you can test would be FSH and LH, and those are typically done at the beginning of the cycle. In PCOS, the LH tends to be higher than the FSH and often around double. And so that's a marker you can look at that's hormonal. Another one is anti-Müllerian hormone. This is a marker of ovarian reserve, which means the number of eggs in the ovaries. And women with PCOS have high levels of this for their age. So again, if you get that handout that I had, you can download it. It's got all the age ranges that you can compare and look at what's PCOS like for the person's age. So those would be the main ones that I would look at.
Okay. Okay, great. Yeah, that's super helpful. And we'll get that link from you. I'll put it in the notes here. Last thing I wanted to cover before we let you go is thyroid. So you were telling me earlier you treat a lot of thyroid. A lot of people in this audience have thyroid issues or suspect they do. So I wonder if you could tell me the links or if any kind of trends you've seen with PCOS and the thyroid.
Yeah, absolutely. So probably about half my practice is treating thyroid patients and prescribing thyroid hormones for patients. So I do see a lot, and a lot of women with PCOS also have thyroid problems. The reason for that is that PCOS, because it's it affects the whole body as an endocrine disorder. So it affects all of the hormones and causes a lot of like jagged hormones. So as women are trying to ovulate when they have PCOS, their hormones kind of go like that more. Whereas for women who don't have it, they're more smooth. And so the jaggedness itself, the thyroid does not like this. And this
Mm,
is why we see so many problems for women with getting thyroid disease after having a baby, after having a miscarriage, or at menopause, because when your hormones change, it throws your thyroid off. And so that's part of it. And the other part is that there's a lot of inflammation in PCOS, which can predispose to Hashimoto's, autoimmune thyroid. So we do see a lot of it. So that's a consideration. If you have PCOS, anytime your hormones change, check your thyroid. Because you're more, even though other women are also prone, you're much more prone to that. Or if you feel anything really different with your energy, all of a sudden you're super tired, all of a sudden something's really different where you've gained weight, it doesn't make sense, you have brain fog. Like those are all things when you have PCOS, you're much more likely for that to be caused by the thyroid. So and the other thing I would say is that women with PCOS tend to have problems converting T4, which is the most abundant thyroid hormone that our thyroid gland makes, but it's an inactive hormone. So they have problems converting that into its active form, which is T3. And the reason for that is that they tend to have much more insulin resistance, inflammation, or problems with their cortisol or adrenals. And that can cause problems with converting. So I usually make sure that if you have PCOS, also ask to have T3 and reverse T3 checked so that you can see, how well you're using your thyroid hormone or how if you're on thyroid replacement or if you're not, how much active thyroid hormone you're making.
okay, so check T3, reverse T3, and I guess you probably want to check everything, right?
Check it all. Yeah, and the antibodies are another one to check because women with PCOS are far more likely to have Hashimoto's. So if you haven't had a full thyroid panel, I would always suggest that.
Okay. Awesome. That's That's so helpful. So we'll share the link to your book. It's on Amazon. That's usually where I get, but anywhere else you want to mention,
Yeah,
you can find it.
that's the best place for sure.
Okay. And your website is White Lotus. Tell me that again.
Yeah, if you're interested in my blog, it's at drfionand.com,
Okay.
and my clinic is at whitelotusclinic.ca.
Okay. And you are seeing clients, you were telling me, just writing these down. You're literally getting a little restricted lately, so mostly seeing local clients in Ontario. Is that correct?
Yes, yeah, we can see clients in Ontario either by telemedicine or in person. Our regulations in Ontario are not allowing us to take distance patients right now, but if you keep checking, that might change. We're not sure. So
It may change,
we'll
yes.
keep you posted. It's just we have new regulations here, so we're navigating that.
So if people fly in to see you, that's okay, I imagine.
Yes, we have a lot of people flying in, or even people
Okay.
coming in for the day and then leaving the same day or just staying one night. But Toronto's a great city, so there's lots
It
to see.
totally is. It totally is. It's really fun. Well,
Yes.
thank you so much for your information, Dr. Fiona. I think it's going to help a lot of people. If you have a question you want to add to the chat, I can kind of tag Fiona to answer it or try to help answer it myself. And I'll put the
Happy
links
to.
to the labs guide, the free labs guide, and the book and all that stuff down below as well in a minute here. Thanks, everybody.
Amazing. Thank you. Thanks for having me, Bridget. It's been awesome to be here.
Totally.